I am so lucky I have access to focused shockwave therapy. This is one of the best treatments in the arsenal of conservative care. We've got regenerative medicine capabilities on par with stem cell and PRP at our disposal. I am treating an old meniscus tear, and I'm delivering focused shockwave deep into my knee joint. This particular setting will go up to about 6.5 centimeters deep. And when you're on the target tissue, you can feel it right there. And if I was working with a patient and that was too intense, I just go over here and do a little reduction in the intensity, let them accommodate. They're going to tell me, okay, yeah, that's much better. Then I'll just come back and bring it back up to the therapeutic dose. All right, Kylie, so you just had your last shockwave session for your left wrist. Tell us how long that left wrist had been a problem.
Years. And anytime I did weight-bearing exercises, it would flare up and be super painful. No movement, no weight-bearing, anything. So it's been years.
And how's it been feeling this last 4 weeks after shockwave?
For the wrist, I felt almost immediate results. I had one treatment, and within a few days, it was probably 90% pain-free. And I could bear weight. Movement was basically back to 100%.
With just a couple sessions here with the shockwave, was able to completely eliminate that pain and get back to activities that I was not able to do for almost 9 months.
If you had something else later that bothered you, would you consider shockwave therapy as part of your recovery?
Definitely 10 out of 10. Any other injury, I'm coming in here to do some shockwave.
Right on. Hey, thanks for sharing your experience, and congrats on your win at the last CrossFit competition. Way to go, man. Since we did shockwave a week ago, what would you say has been your improvement level?
I don't feel injured anymore. So, I did several weeks of PT, and then one treatment of shockwave was like several weeks of PT.
Wow.
Or maybe even more. It accelerated the healing process, which at someone my age was really nice, considering it takes so long to heal at my age.
It's been what, 4 sessions?
Mm-hmm.
And I feel better now than I have in probably 5 years, I'd say.
Pain-free. I can lock out shoulder in tight positions. I can do overhead strength movements. It just really can allow me to rely on my body and, the training that I put myself through to complete the tasks. And once this shockwave, therapy came along, it just allowed the whole left side to work as one unit in unison. It was great.
If you are sore, try some topicals that are non-NSAID, like BioFreeze or Tiger Balm. You can always put a little heat on there, or try, any of the muscle rubs, the arnica-based stuff should be fine.
Okay.
Move the elbow around a little bit, make sure I didn't knock anything loose.
No, it feels significantly better even just right now. Like
cool.
Before, extension was like, oh, I feel that. And now I barely feel it.
Okay, I love that. Can you put your arm out straight and cock your wrist back really hard? Any pain with that?
No.
And arm out straight and hold. Don't let me move your finger. Is that okay?
Yeah.
Good. Make a fist. Don't let me move you. Here.
Yeah.
And bend the elbow and hold. Is that all okay?
Yeah, no
Cool.
pain anymore at all.
I like it. So I think you'll respond well to shockwave therapy, and we'll include this in your program.
Okay. That's magic.
Yeah.
I literally don't hurt, and I came in here without hurting. So that's
I like that.
That's really cool.
Right?
Mm-hmm.
So this is like pressure, like me doing deep tissue, minus some of the pain.
Minus a lot of the pain, yeah.
Right, versus if I were to release that myself, I would have to be in there like that. Right? That's the difference between trigger point release
I mean, with this one, I want to tense up and kind of go against it, and I have to tell my body to relax. With the other one, my body doesn't have to be told to relax.
No pain.
But no shoulder pain.
No shoulder pain. Back to plank.
It's been 10 months since the
Oh,
fracture.
it's before, yeah, it's 10 months since, almost 10 months.
And this one session, how much improvement have you felt in just this one session?
I have not been able to do that before. So that's a first.
Wow.
Okay.
All right, Trace, tell us a little bit about your experience with Shockwave.
Well, it's been super helpful in my recovery process. I had a high grade 2, low grade 3 sprain that should have had me out for 2.5, 3 weeks, and I was back in it in 5 days in a high intensity impact sport.
Nice. Did you miss any playing time?
I did not.
Good. Good for you, man. You're looking great.